Hollywood my channel Hollywood Box TV. Subscribe you like subscribe notification.
I just want to remind everyone to please mute your phones if you are listening in, and then we'll take questions at the end of my statement. But I wanted to give a quick update on where we are in South Dakota in our response to COVID-19 and the virus across the state. As a reminder, we've got covid.sd.gov up and up to date every day at noon. New numbers have been put up there this morning. We do have a couple of communities that have community spread, but thanks to the work that everyone has already done, we've been able to prepare. I want to thank everyone for taking social distancing seriously, for continuing to wash their hands, to make changes to their lifestyle so that we can slow down the spread of the virus in our state, and it is working. We have had 46 positive tests in the state. 16 of those 46 have fully recovered. That's good news for us. We have 1,973 negative tests that have been processed, and we have 125 at the state public health lab that are still pending. We expect that by Monday we will have the pending tests down to 0, and that is good news as well. Here in South Dakota, we have 2 other commercial labs that have come fully online in the last week. That is exactly what we wanted to see happen to give us more capacity in testing. And then we've also been able to give our healthcare providers more time to prepare and take care of individuals. I want to remind everybody that 80% of our people that do get infected with the virus will have very mild symptoms or none at all. It's the other 20% that we're working to get our healthcare providers online for and prepared to care for, because they will have a need for some type of care into the future. Our hospitals have been working really well with us. Today we're going to have a phone call with our providers in the state to address surge capacity. That means knowing that we won't peak in infections for quite some time, probably a couple of months. We want to make sure that we're preparing and planning and that we have the capacity online with our healthcare providers to address that need. I also today will have a phone call with county commissioners in the state to answer any questions that they have as far as counties go and their jurisdiction and the authorities that they have. And I will be working to make sure that we have a lot of communication with our legislators as well. Tonight I'll have another conference call with them and answer their questions when it comes to veto day. We will be dealing with the state budget, which has dramatically changed in recent days with the lack of revenue coming in to the state to help take care of people through this crisis, and then also asking them to pass some other specific pieces of legislation that will help us respond and care and do the work of the people of South Dakota going forward. I had spent a lot of time over the recent day or two talking to our federal delegation about the CARES Act. I'm very grateful for all of their hard work on this legislation. It's incredibly important for South Dakota. There will be revenues that will be coming to our state that will help us pay for some of the costs in response to COVID-19 in the state. I've been working with administration officials. I talked quite extensively last night with Larry Kudlow. He's been helpful in talking through some of the language. There are a few tweaks and things that I would like to have addressed that I'm going to be working with Treasury on to make sure that we have funds that are available to us as a state, that also they will be distributed appropriately and that we can utilize them in a way that will really address the needs that South Dakota is seeing. I'm really grateful for their help, for Larry's time, and also for our federal delegation, because they spent a lot of time making sure that this was a bill that would be good for South Dakota. I also understand that Senator Thune is not feeling very well, and I want to let him and Kimberly and his family know that Brian and I and our kids are praying for him and hoping that he feels much better real soon. Second, I just want to touch on the unemployment claims that we're seeing in the state of South Dakota. They've dramatically changed. Just last week, Monday through Sunday, we saw 1,703 initial weekly claims for unemployment benefits. Most of these individuals were brand new people signing up for the program that had never been on unemployment before, and now they're signing up because their jobs have been affected by this virus spreading across the state. It's an increase of just week to week of about 1,500 claims, which is dramatic. And one thing I want to prepare you for is that we are seeing almost that number of unemployment claims per day this week. So expect big, huge numbers next week, and people signing up for unemployment because literally our economic activity in the state has dropped to almost nothing. And it is something that we have to continue to balance with every decision that we're making, how we're impacting not only public health and keeping people safe, but also how we're making sure that they're putting food on the table and keeping roofs over their heads and making sure we can sustain the plan of action that we put into place for months yet. Because I cannot be more clear, we are not going to be out of the woods here in South Dakota in a week or two. We are going to have to sustain the activities that we have in this state for at least another 8 weeks, maybe longer. We do have good news on testing today. I'm grateful for all the hard work of those individuals at our state public health lab. I'm grateful for the healthcare providers that have brought their labs up and are running. The one indication I do want to give to everyone today is that we have no additional positive tests coming from any inmates in the state of South Dakota. And that does include the 3 that did walk out of the facility a couple of days ago that now have been brought back in. They have been tested and their test came back negative. I want to remind you of a couple of things that you can do. If you're sitting at home watching this, I want you to go to volunteer.sd.gov and sign up to help. If you're a medical provider, if you're a nurse, anesthesiologist, a dentist, wondering what you can do, please go sign up and register to help at volunteer.sd.gov. And that is also, that information is on covid.sd.gov, but we need your help making sure we're prepared for the future. If you are not a medical professional, but you still want to go out and help individuals, but you can go and register for that as well too. It's incredibly important. Anybody who wants to serve at this time, we will be coordinating through our Department of Health to make sure that you are engaged as we go through the coming weeks. Again, the 800 number, 1-800-997-2880 is available. Continue to call with any questions that you may have. Don't call if you are not feeling well. If you're not feeling well, call your doctor. This 800 number is for those individuals that may have questions about the response the state is partaking in or any of the other questions that may come up as far as information goes. And again, boy, get on board and help the Red Cross. They are at critical levels of needing blood. So if you could contact them, see what you can do. If you are healthy and an individual that can give blood, boy, they could use your help right now because we need to keep our blood supplies up going forward, and they are on the front lines of addressing that need in the state of South Dakota and throughout the nation. With that, I'll open it up to any questions that you may have.
Kelly Volk with KELOLAND News. Can you say how many tests are out in private labs right now? If any of those are a part of the 46, and if not, when can we expect those results?
Well, I'll summarize the results that we have just posted online today. We have 46 positive tests throughout the entire time frame we've been dealing with COVID-19 in our state. So of those 46, 16 of them have fully recovered. So we have 30 active positive cases out there in the state. We have 1,973 negative ones, and that is including all that were run at the public health lab and some from the commercial labs. We have not always been able to get all the negatives reported back to the state public health lab. Sometimes we haven't gotten that information, but we do get all the positives reported to the state public health labs. So we are asking those labs to report to us, and most of them are. It just hasn't always necessarily been true if that commercial lab wasn't in the state of South Dakota. And I'll turn it over to Kim and let her give any more clarification she can.
I would just add that of the 5 new cases that were reported today, one of those was from the state public health lab, and the others were positive cases in private labs.
Can you describe what fully recovered means, please?
So fully recovered are individuals that do not have symptoms. They've been fever-free for at least 72 hours, and they've been at home for the requisite amount of time to ensure that they're not infecting other people. So these people are well, and they're able to do what they need to do on a daily basis.
Thank you.
Hi, Governor. Can you that's what you feel about your thoughts on the stimulus bill, and what do you like in it? What else would you like to see in that?
Well, looking at the federal legislation, I've had my team digging into it now for the last day or two. We're getting more information all the time. A lot of it will depend on how the Treasury Department interprets certain definitions of how that money flows to the state of South Dakota. Looking at the bill ourselves, we do see that there is some reimbursement for costs associated with our response to COVID-19 in the state of South Dakota. There's some concern on what we do about revenue loss at the state level, because we do have revenue loss dramatically impacting our state right now. And we have every agency and department that is responding to this virus and how it's affecting our families and communities. So we're working that out and have appreciated the conversations we've had with the administration on how that will be determined going forward into the future, and what Treasury can do to give us some flexibility to make sure that we are having the ability to sustain state government in our response to this virus.
Hi, this is Morgan.
Governor stated that.
I am for Kim.
Kim?
Our mayor sent you a letter today with 10 questions, and I trust that you've seen it. Do you have any answers to those questions right now?
Yes, the answers to those questions are very simple and easy to get, so we'll respond to that formal letter. I do know the mayor has my cell phone number, so he can feel free to reach out to me at any point in time, too. So, but that's all information that we'll be getting to them shortly.
Governor, does the state have an existing pandemic plan, and how has that been followed?
This is Kim Malsom-Ryston. The state does have a pandemic influenza plan. Many of the strategies that are part of that are being deployed right now. In addition, hospitals across the state have their own preparedness planning, and so we're using strategies that they had already planned to use as well.
Governor, I had a question. President Trump said that he was pushing to get the country up and running by Easter. Based on what you're seeing on the ground in South Dakota, does that seem like a realistic time frame to you?
You know, that's the interesting thing about this situation we find ourselves in, is that the facts on the ground and the reality of what we deal with every day does change, although I do think that the plan that we put forward as a state is working. We are slowing down the spread of the virus so that we can handle it and we have the capacity to take care of people. Meanwhile, we are allowing people to be innovative, and we're allowing them to continue to get their groceries, to continue to feed their families, to be able to sustain the activity and life that we have here in South Dakota for weeks and months to come. So, you know, I know the president is working on a plan for the country. I'm focused on South Dakota, and what I'm seeing here using the facts and the data that I have available to me, and I really do believe that the plan that we put forward is the best. In fact, I've heard other governors that have gone out and shut down businesses or issued stay-at-home reports now questioning if that was the best public health plan, that they're questioning if that decision was correct. I am convinced that the decisions we've made here in South Dakota were made based on science, on addressing public health needs that we have, data and facts, and that it's working for our state.
But do you think that Easter is a realistic time frame for you all in terms of getting South Dakota back on a normal track?
I do not think South Dakota will be back to normal for many months. Many months. This is a long-term situation we have in front of us today. So those who might think that by Easter things will be back to normal, I don't want to discourage them, but I want to be very clear and honest with them that we will be operating differently for many, many weeks to come yet in South Dakota, because we can't stop this virus. We can slow it down. We can make sure that we're protecting people, that we're prepared to handle it. But this virus is an enemy we're all fighting, but we can't stop it in South Dakota. We can protect people and let it work its way through in a manner that we can manage as best we can. It is an unpredictable situation, and every day we wake up and respond to the situations that we see on the ground in the state.
PPE.
Governor, this is Trevor Mitchell with Argus Leader.
I'm going to take a question in the room, and then I'll go back to the Argus Leader on the phone.
PPE and other supplies brought by the federal government, are they holding up, and how's that going?
They are. We have received enough chemicals and reagents in our public health lab to last us quite some time. We do have good supplies here in South Dakota today to last us for several weeks for sure, and we will continue to make sure that we're putting in the proper requests with FEMA to keep us adequately supplied. Okay, on the phone, the Argus Leader. I'm not sure who was asking the question.
Thank you, Governor. This is Trevor Mitchell with the Argus
Okay.
Leader. We've heard from local hospitals here in Sioux Falls that they're limiting tests to higher priority cases, even sometimes when people are symptomatic. So we know that everyone obviously isn't getting tested. Do you have any sense from the people you're talking to in your administration beyond those state lab numbers that we get, how fast this disease is spreading?
This is Kim Alsam-Risden. So as the governor indicated, our latest results on the website do include test results from labs outside of the state public health lab. So that is real information on tests happening in South Dakota. To your question about what's going on with who can get tests, we need to be good stewards of the resources that we have, and that extends to the testing capacity that we have. We expect healthcare providers who are able to test to be good stewards as well. So we all have to make good decisions to ensure that we're having the best impact on our population, and that will mean, calculating who we can test reasonably.
Governor Mark Walker, Pioneer. When people do go to the ER or urgent care, they test negative for influenza, they test negative for strep, they still are exhibiting COVID symptoms, and they're denied a COVID test. What should they do?
You know, our healthcare providers and I and our team have spent hours and hours together, and the communication is that we are following CDC guidelines and that our providers are making those decisions on the protocols that they go through to issue tests to individuals. I've been very clear with all of you too for the last several weeks that there will be a point in time in South Dakota where the testing does not help us locate and define how the spread is continuing across the state of South Dakota. There will be many people that will be coming positive for COVID-19 to where the testing for those who are young and healthy will not happen necessarily for everybody. But just know that all of our healthcare providers, our doctors, are following protocols that are well established, that the CDC is recommending, and I'm confident in their abilities to issue those. I don't want to second guess what's happening in every doctor's office across the state of South Dakota. They are the experts. We have not directed them at all at the state on what those protocols should be and who gets a test and who doesn't. We have recommended that they follow CDC guidelines, though, because that is the best way to make sure we're making the best decisions for our public health.
Have you considered
This is Stephen from AP.
Stephen, go ahead.
Could you tell us a little bit about the details of the legislation that you're asking for? Will you ask legislators to pass out on veto day, and what are the specifics of that action?
There are several different bills, and I don't want to go into details until I've had the opportunity to brief the legislators on those tonight on a conference call. So it will deal with response to COVID-19 and authorities that I may have. It'll also talk about economics and some of the abilities and programs that we have, making sure that we can utilize some resources to help businesses and families get through this situation. There will be budget bills that we will need to make decisions on, how we will handle those and where we'll make changes. And then obviously I've got a couple of bills that I did veto that they'll make decisions on as well.
Can you say?
Have you considered expanding Medicaid in the state?
I'm going to take a question in the room with Kelly first, and then I'll answer the one about Medicaid on the phone.
Thank you, Governor.
Yes.
Can you say how many people are currently hospitalized because of COVID-19?
Yep.
At this time, there are 2 to 3 individuals in the hospital.
Okay, the question about Medicaid on the phone?
Yeah, have you considered expanding Medicaid in the state at this time?
Oh, expanding or extending? Are you asking about extending or expanding Medicaid? We're not currently in discussions about expanding Medicaid. As far as extending, I'm not sure what the question means. But we could follow up separate too if there's more clarity to that question later on. Next question.
Question for
Governor,
Secretary Noem. Governor, this is
Jonathan
South Dakota
with the
Public
Argus Leader.
Broadcasting.
South Dakota Public Broadcasting.
Thank you, Governor. I'm wondering if you can give us an update on the situation with Monument Health and the patients who were possibly exposed.
This is Kim Alsam-Risden. We're working actively with the folks at Monument Health to work to identify any potential exposures. We are fully confident that Monument Health is taking the appropriate action to limit any ill health effects.
Do you have an idea of how many people were identified and contacted by the Department of Health who were possibly in contact? I know Monument yesterday said at least 100.
I don't have that number with me. I can tell you, though, that we are working cooperatively with them to notify individuals.
I know from some of the reports that I saw, there was the potential for over 100 people that were exposed. So there was patients involved, doctors and nurses. Most of the people that were exposed through that incident were patients at the facility.
Do you know if any of those people have been tested?
No, but I'm sure they will be. Anybody that has been in contact with someone who has a confirmed positive case, and especially in this unit, they may become go through that protocol with their providers to be tested, yes.
Governor, I think you're done, right? This
yes.
is Jonathan Ellis. Two questions for you. City elections coming up, what's to be done there? And then you guys are monitoring real-time hospital capacity. What are you guys seeing there?
We're seeing good capacity at this time. I'll let Kim give you some details if you want actual numbers on that. We are looking for all of our providers and hospitals to add capacity, and that's the plan that we're working on now, and that we're utilizing all of our agencies, departments, and planners within our National Guard to help work out exactly in the next couple of weeks how we will staff those up, and then also get the logistics of beds available and converting some beds over to different uses. So I'll let Kim talk a little bit more about that. Your other question was about city elections, and I do believe that when I visit with the legislators tonight, we'll have a plan going forward as well on what we'll do regarding elections that are coming up this spring. And also something that I don't think we've covered is that when I'll be talking to the legislators tonight about how we'll be conducting veto day electronically as well. So legislators will not be coming into Pier to conduct veto day. We'll be doing it electronically and remotely. I'll let Kim discuss the hospital bed capacity.
So as the governor indicated, we do feel good about our current capacity across the state. We also monitor kind of high need equipment. I know we've gotten a lot of questions around ventilators. We currently have only about 1/6 of the current ventilators available in our state in use. So we've got capacity there. There's some new technology that is able to be used with ventilators to make those go even further when we do have that need. So that's some of the things that we're planning on. But relative to hospital bed use, we are working with our hospital providers across the state to be able to surge their ability to serve people and feel good about that progress.
Thank you.
The actions we've already taken as a state have made a big difference in our ability to handle the patients that we may see in the future. So I want to commend the people of South Dakota. You have been fantastic at taking this serious, and it has made all the difference in the world. Your ability to stay home and to isolate and social distance for you and your family has made all the difference in the world in allowing us to spread out the rate of infection, to make it later on into the spring so that we have the capacity and are in a much better position when it comes to our hospital bed situation and our caregivers being able to take care of the individuals that may contract the virus and have some complications because of it.
Governor Kellogg is here. Just a question. You mentioned revenues. Do you have any idea on the hit it's taken so far? Can you give us some numbers?
I can't give you specific numbers, but because they are fluctuating so much every day and we're taking a snapshot in time, obviously we've seen huge changes in the last 2 to 3 weeks, especially since the federal government and the president has asked everyone to stay home for 15 days. That had a dramatic impact on our economy. So we're using what we have, putting it through an analysis, trying to predict if this goes on for the next 4 to 6 months, where we will be at, and it is a significant impact on our state revenues, and we are planning as well as we can for the future, and we'll be tightening our belts in areas to make sure we're making wise decisions.
Let's take one more question, please.
Thank you.
Governor, or probably Kim, where are we at as far as number of tests we can run in a day with the State Health Lab, the Sanford, the Avera, kind of all together? How many can we come through in a day?
So the capacity, as I understand it, with Avera and Sanford is once they're totally ramped up, which they may already be at, otherwise very soon, that'll be about 600 tests a day. In addition, our lab can run You know, I think we've run up to 180 tests in a day, and we can certainly surge higher than that if we need to, but we just haven't had the need to. We're prioritizing those high priority populations.
So we're at almost 800 a day in state that
Sure.
we can do.
Yep.
Okay. Thanks so much, everybody. Talk to you soon.
And so there you go, Governor Kristi Noem with their daily briefing regarding the coronavirus and its impact, stating that South Dakota now reporting 46 positive cases. 16 have now fully recovered, 1,900 tested. She also says don't expect normal for many months to come in South Dakota, and that we are still looking out about 4 to 8 weeks before we get through this tight isolation period. So that's how things shape out from the state side. And this afternoon, probably in about a couple of hours, I think around 3 p.m., we'll go live again to City Hall and get the latest from the coronavirus team here locally.